Hello friends, I'm Dr. Sree Durga. I'm the head of fertility unit at Virinchi hospitals. We all know since decades 8th March has been designated as the International Women's Day, our day. And every year a theme is assigned to that particular day, or let's say that particular year. And this year the theme is Break the Bias. Yeah, that's the sort of logo for it. Break the bias, that means breaking the bias regarding gender inequalities or financial inequalities, etc. Today in this small talk, my agenda is going to be reproductive liberation, reproductive freedom, let's say reproductive empowerment. And aging is not in our hands. For us women, our biological aging, that is our ovarian aging, starts even before we were born and it stops at menopause. And what happens with age is your egg quality, then your egg quantity decline, and all this decline in the quality leads to chromosomal abnormalities, and the chromosomal abnormalities can lead to infertility issues later in the future, or pregnancy losses, or babies born with some genetic abnormalities. And our today's babies are tomorrow's future, right? And you have been hearing since few years, women are freezing eggs either because of medical indications or for social reasons. And thanks to exponential advances in the recent fertility technology, the success rates have been very good actually. But there is a term attached to that egg freezing. You call it either social egg freezing, or you call it's an elective procedure. It's called elective procedure. I campaign for this. Please remove the term elective. Well, elective means what? The elective conjures, it's not a medical necessity. It is not needed. So what happens is these third-party payers, they deny to cover these procedures. Even the the multinational companies, they refuse to refurbish for this sort of scheme or treatment plans. We fertility advocates or patient health advocates, I propose that like any mammography, pap smear, colonoscopy, they're all part of your well-being health maintenance programs, right? So why is not reproductive well-being doesn't come under any health maintenance? So they should be for a woman, they should be a reproductive health maintenance, and these sort of treatment options, or I would not say treatment options, but preservation options should be offered the third party payees. And I emphasized just few minutes back that normal healthy women, normal healthy eggs, and normal healthy children, and these children are our future society, a healthy society. So we all go for periodic health checkups as a preventive measure, right, to avoid future disasters, health disasters. So why don't we as a woman, I urge all the women, the young women or the middle-aged woman, why don't we go for a periodic reproductive health checkups? How good is your reproductive system? It's a preventive measure. In fact, so something is on borderline or something is already crossed a borderline, when to act. So I would urge all the women, you should be having a reproductive health periodic checkup as well. I know this is an economic burden to women, but you just think over it. It's just common sense. Let's think over it. Now women form nearly 50% or more than 50% of a population, and in some families they are the breadwinners. So you have no choice but to delay your dream of becoming mother or to build up your family until you secure your career or you're the earning member of the family. So you have no choice to delay your motherhood. So in those situations, what else you got? So the sensible plan is you invest now, so that when you're ready for motherhood, or when you cross that age limit, at least you don't have to invest a huge in all these fertility treatments like IVF. And IVF at certain age, let's say the age cutoff after 35, the success rate with the huge investments of IVF in lakhs, the success rate is not that huge. So think over, you invest your eggs when you're young, it is a good investment, might save wasting a lot of money for fertility treatments in lakhs in the future. Plus, like I told, healthy eggs, healthy children. So healthy eggs come when you're young. So friends, think about it. And the other thing is, it is a campaign today. We should all campaign for all these insurance companies and the multinationals. Why don't you all offer your women employee this, involve them in schemes where they can gain fertility freedom or fertility empowerment, and that comes with when their fertility potential is frozen at certain age. And one example, a statistical example, let me say, after 35 you need 30 eggs, 30 eggs to get that one normal egg. That means one normal child. And 30 eggs, they come with multiple IVF cycles involving lakhs. So think over, friends. So it is a good investment, and I would urge all the the third-party payees or even our medical societies and the gynecological societies to not to stigmatize this egg freezing as some boutique treatment. It is in fact a fertility preservation, is a preventive treatment to beget normal healthy children in the future. Some transparency and freedom for women to make some informed choices about their future. So friends, let's campaign this International Women's Day that fertility preservation is not elective, it's not a boutique treatment. Don't stigmatize it. It is just like any health preventive checkups, it is a fertility preservation modality. Secure your reproductive future. Thank you.
Visit Virinchi Hospital for evidence-based treatment.